Impact of Planned Parenthood cuts on healthcare access in New Jersey. Democrats warn of dangers to healthcare access from Planned Parenthood funding cuts. In a striking display of solidarity, two Democratic representatives stood alongside Planned Parenthood officials outside a clinic in Perth Amboy on Monday, voicing their concerns over the recent GOP budget bill. They argue that this legislation poses a significant threat to reproductive health care access across New Jersey. At the heart of the controversy is a provision in President Donald Trump's so-called Big Beautiful Bill, which prohibits Medicaid funds from being allocated to Planned Parenthood facilities. Representative Mikie Sherrill, D. Montclair, who is also the Democratic candidate for governor, and Representative Frank Pallone, D. Long Branch, emphasized that this policy will create barriers for New Jersey residents seeking essential reproductive health services, including cancer screenings and STI testing. The Trump administration has framed the bill as a measure to eliminate federal funding for what they term big abortion. However, it is crucial to note that Medicaid has not covered abortion services for nearly 50 years. In response to this legislation, Planned Parenthood has initiated legal action against the Trump administration, and a federal judge has temporarily halted the implementation of this provision. The White House has dismissed this judicial ruling as absurd. Additionally, New Jersey Attorney General Matt Platkin has joined a separate lawsuit against the Trump administration, arguing that the blocked funds exceed the authority granted to Congress. Pallone expressed grave concerns about the potential consequences of defunding Planned Parenthood, stating that clinics may be compelled to reduce their operating hours, lay off employees, or even close their doors entirely. Historically, people have never been able to use Medicaid for abortion services, Pallone remarked outside the clinic. However, what this Big Beautiful Bill does is effectively state that you cannot use Medicaid for your fundamental healthcare needs. Sherrill, who is set to face Republican candidate Jack Ciattarelli in the upcoming November election, highlighted the critical role of Planned Parenthood in the state. Last year, these facilities served 123,000 patients, conducted 170,000 STI tests, and performed 13,000 cancer screenings. 1 in 3 of those patients depend on Medicaid, and this care is absolutely vital, she stated. The Congresswoman also pointed out that Planned Parenthood has previously faced funding cuts under former Governor Chris Christie, which she argues had detrimental effects on the health of New Jersey residents. In 2010, Governor Christie cut funding for Planned Parenthood, and as a direct result, STIs surged by nearly 27% over the following 5 years, she noted. This is the reality we are confronting. Joining the Congress members in Perth Amboy were Alexis McGill Johnson, the president of Planned Parenthood, Dr. Elizabeth Talmont, a provider with Planned Parenthood of Northern, Central, and Southern New Jersey, and Caitlin Wojtowicz, the executive director of Planned Parenthood Action Fund of New Jersey. Talmont explained that the clinic, one of nearly 24 in the state, provides a range of services including birth control, cancer screenings, STI tests, and abortion care. If these funding cuts are implemented, we will continuously evaluate and identify where the greatest needs lie and how we can best respond to them, Talmont stated. While we greatly appreciate the support from our state partners, the Big Beautiful Bill is anticipated to displace hundreds of thousands of New Jerseyans from Medicaid or food stamp programs and reduce taxes for many residents. Since its signing by the president a month ago, it has drawn widespread criticism from Democrats. Sherrill, who may find herself in a position to lead the state government next year, mentioned that the state might need to address some of the gaps left by the federal cuts. But she remains hopeful that the ongoing lawsuits will yield positive outcomes. We are witnessing attacks on affordability from all angles, which underscores the necessity for a broad interpretation of state power to fill these gaps, while simultaneously resisting these federal actions, she explained. This is why I believe the court battles are of utmost importance as we strive to reclaim some of the federal funding here in New Jersey. Pallone added that with $3.3 billion in healthcare cuts and potentially hundreds of millions more in SNAP benefits at stake, it will be nearly impossible for the state government to compensate for these losses. How can all levels of government in New Jersey possibly cover the shortfall from these Medicaid and nutrition cuts? Pallone questioned. It's virtually unfeasible. This article has been updated to clarify a statement made by Sherrill.